a group plan that spreads risk between sick people and healthy people, between young and old, and then bargains on your behalf for the best deal on healthcare. What we've done is essentially created competition where there wasn't competition before. We created these big group plans, and now insurers are really interested in getting your business. And so insurers have created new healthcare plans with more choices to be made available through these marketplaces. And as a result of this choice and this competition, prices have come down. When you add the new tax credits that many people are eligible for through the law, then the prices come down even further. So one study shows that through new options created by the Affordable Care Act, nearly 6 in 10 uninsured Americans will find that they can get covered for less than $100 a month. Think about that. Through the marketplaces, you can get health insurance for what may be the equivalent of your cell phone bill or your cable bill. And that's a good deal. So the fact is, the product of the Affordable Care Act for people without health insurance is quality health insurance that's affordable. And that product is working. It's really good. And it turns out there's a massive demand for it. So far, the national website, healthcare.gov, has been visited nearly 20 million times. 20 million times. And there's great demand at the state level as well, because there are a bunch of states that are running their own marketplaces. We know that nearly 1/3 of the people applying in Connecticut and Maryland, for example, are under 35 years old. They understand that they can get a good deal at low costs, have the security of health care, and this is not just for old folks like me, that everybody needs good quality health insurance. And all told, more than 500,000 consumers across the country have successfully submitted applications through federal and state marketplaces. And many of those applications aren't just for individuals, it's for their entire families. So even more people are already looking to potentially take advantage of the high-quality, affordable insurance that is provided through the Affordable Care Act. So, let me just recap here. The product is good. The health insurance that's being provided is good. It's high quality and it's affordable. People can save money, significant money, by getting insurance that's being provided through these marketplaces. And we know that the demand is there. People are rushing to see what's available. And those who've already had a chance to enroll are thrilled with the result. Every day, people who were stuck with sky-high premiums because of pre-existing conditions are getting affordable insurance for the first time, or finding, like Dennis did, that they're saving a lot of money. Every day, women are finally buying coverage that doesn't charge them higher premiums than men for the same care. Every day, people are discovering that new health insurance plans have to cover maternity care, mental health care, free preventive care. So you just heard Janice's story. She owns her own small business. She recently became the first woman to enroll in coverage through Delaware's exchange. And it's true. It took her a few tries. But it was worth it, after being turned down for insurance 3 times due to minor pre-existing conditions. So now she'll be covered. She'll save $150 a month. And she won't have to worry that one illness or accident will cost her her business that she's worked so hard to build. And Janice is not alone. Now, I recently received a letter from a woman named Jessica Sanford in Washington State. Here's what she wrote. I am a single mom, no child support, self-employed, and I haven't had insurance for 15 years because it's too expensive. My son has ADHD and requires regular doctor visits, and his meds alone cost $250 per month. I've had an ongoing tendonitis problem due to my line of work that I haven't had treated. Now, finally, we get to have coverage because of the ACA for $169 per month. I was crying the other day when I signed up. So much stress lifted. Now that is not untypical for a lot of folks like Jessica who have been struggling without health insurance. That's what the Affordable Care Act is all about. The point is, the essence of the law, the health insurance that's available to people, is working just fine. In some cases, actually, it's exceeding expectations. The prices are lower than we expected. The choice is greater than we expected. But the problem has been that the website that's supposed to make it easy to apply for and purchase the insurance is not working the way it should for everybody. And there's no sugarcoating it. The website has been too slow. People have been getting stuck during the application process. And I think it's fair to say that nobody's more frustrated by that than I am. Precisely because the product is good. I want the cash registers to work. I want the checkout lines to be smooth. So I want people to be able to get this great product. And there's no excuse for the problems. And these problems are getting fixed. But while we're working out the kinks in the system, I want everybody to understand the nature of the problem. First of all, even with all the problems at healthcare.gov, the website is still working for a lot of people. Just not as quick or efficient or consistent as we want. And although many of these folks have found that they had to wait longer than they wanted, once they complete the process, they're very happy with the deal that's available to them. Just like Janice's. Second, I want everybody to remember that we're only 3 weeks into a 6-month open enrollment period when you can buy these new plans. Keep in mind, the insurance doesn't start until January 1st. That's the earliest that the insurance can kick in. No one who decides to purchase a plan has to pay their first premium until December 15th. And unlike the day after Thanksgiving sales for the latest PlayStation or flat screen TVs, the insurance plans don't run out. They're not going to sell out. They'll be available through the marketplace